For this video, we will cover the principle of disinfection. In general, when determining if you're going to use an agent to disinfect a surface, you have to consider the following things: the concentration of the agent, if it's used on organic matter, the pH, and the time exposure on the surface. The biggest determinant here is whether or not you're using it on organic matter or not. Basically, antiseptics should only be used on organic matter or a patient, while disinfectants are used on fomites or inanimate surfaces. Now, we have a couple different ways to test the effectiveness of our agents, whether it's an antiseptic, disinfectant, or antibiotic. The first method is the tube dilution test. Here, a series of tubes have had a specific agent added to them at a decrease in concentration. Each consecutive tube has half the concentration of the agent, and the tubes are then inoculated with a test sample. For our experiment here, let's say it's Staphylococcus aureus. Once the tubes have been incubated, we can now see which tubes grew the staph and which did not, showing us two things: if the agent was effective and what the minimal inhibitory concentration, or the smallest amount of agent that we needed in order to kill staph. Another method is the disc diffusion test, or what's called the Kirby-Bauer plate test. Here, an agar plate is inoculated with the sample, again staph, and discs impregnated with different agents are added to it. For our case here, let's say penicillin, vancomycin, bleach, and hydrogen peroxide. After incubation, the plate is examined and we look for what we call the zone of inhibition, which is a clearing around the disc with no growth on it. The greater the zone of inhibition, the better our agent was. These can then be compared, and in our example, vancomycin and bleach both were able to kill staph pretty well. However, hydrogen peroxide could only kill it a little bit, and penicillin had no effect whatsoever. The last method that we can use is the E-test, which is basically a mix between the two. In the E-test, you use the same procedures in the Kirby-Bauer test, except you use a strip with decreasing concentrations of our agent from top to bottom. So here, you will also be able to tell the minimum inhibitory concentration based on where the zone of inhibition intersects with the strip. Now, when we compare the three methods and decide which one is best to do, we use three criteria. Can it tell if the agent is effective? Can we test more than one agent at once? And can it tell us the minimum inhibitory concentration? Now, they all tell us if the agent is effective or not simply based on the growth of our sample. In the Kirby-Bauer and the E-test, we can test multiple agents at once, but we cannot in the tube dilution test. The E-test and the tube dilution test can tell us the minimum inhibitory concentration, but the Kirby-Bauer test cannot. So in the end, the E-test is the best test to do as it covers all the criteria. However, it is also the most expensive one to run, which is why the Kirby-Bauer test is ran a bit more frequently than the E-test. This concludes our video covering the principles of disinfection.